going to discuss the first line agents in different types of the seizures. And as we begin, we will ask a question, that is, in terms of the atypical absence seizures, what is the medication? So we'll find out this answer and learn in detail about this subject. So to begin with, in terms of the focal seizures. So in terms of the focal seizures, what are the first line anti-epileptic drugs? So in terms of the focal seizures, it includes, there is the carbamazepine. Next, there is also the oxcarbazepine. Then there is also the lamotrigine. And there is also the levetiracetam. Next, there is also the phenytoin. So this was totally with respect to the focal seizures. Then we move on to the GTCS. So in terms of GTCS, what are the medications? So it includes the sodium valproate. Then there is also the levetiracetam. So there is levetiracetam. Next, there is also the lamotrigine. So after this, we are going to look at the typical absence seizures. So in terms of the typical absence seizures, what do we have? So here there is the ethosuximide. So this is nothing but the DOC. What do I mean by DOC? It is a drug of choice. That is ethosuximide. So other typical absence seizures, the medications, it includes the sodium valproate as well. So the sodium valproate. And after this, there is also the lamotrigine. Next, we are going to look at the atypical absence seizures. The atypical absence seizures. So what happens in this atypical absence seizures? So here the first line of anti-epileptic drugs given is nothing but the sodium valproate. There is sodium valproate. Then what about the myoclonic seizures? So in terms of the myoclonic seizures, what is used is the DOC is nothing but the drug of choice is the sodium valproate. So after the sodium valproate, we can also give the lamotrigine. There is lamotrigine, and then there is also the topiramate. So now we'll be answering our questions. So we just asked one question. So in terms of the atypical absence seizures, what is the first anti-epileptic drugs? What are the first line drugs? So here we have the sodium valproate. So this was about the first line agents in different types of seizures. To learn and grow daily, please do subscribe.